go. For those that aren't able to make it, and that would be Joy Dahl. She is our Hub Social Care Advisor. You'll see her in future meetings. And then Savannah Minnick, we just hired her as well as our marketing communications specialist. And she'll be starting with helping us update and get our website, just looking fabulous and getting all your new bios up onto our website. And that'll be probably her first endeavor for us. So, but I just want to say, what an amazing team. What do you guys think? These are incredible people that we've brought together. Really excited about what we're going to be able to do in the new year. We are right now considered a top emerging CCH nationally. What is CCH? Community Care Hub. You're going to see some a page on the slot on my presentation that has some acronyms. But we are a top emerging community care hub nationally. And that is even before all some of these wonderful people that we're bringing together to our team. So I'm just really excited about what we can do all together for the next few years. So I hope you guys feel the same way. So what I'm going to do now is I'm going to bring up a presentation. I want it to be really informal. So ask questions at any time. Just stop me. I like it when we can get into discussions. We have about 30 minutes. I want to try my best to give some time at the end. So I might go a little bit quick through some of these. Don't worry about not getting all this in and internalizing and understanding it all right today. This is going to take some time. It's just really good that you might just hear these terms now and hearing them more and more often, and you'll start to maybe better understand it. One term I'm going to throw out there is like the umbrella hub arrangement. That brings in Michelle. You'll see a little bit about that. That is super complicated. Don't worry about it. Just internalize it. We do this. I'll share a little bit more about it, but you will learn more and more as we go along. So I don't want you guys to feel like you have to know all this right away. We are going to take our time with everyone. And hopefully what you will take out of this is that we are doing a lot of great things for our community, and that's who we prioritize. And that's why we have all of you that have such great expertise in working with a diverse population, and you're already boots on the ground doing this hard work in the community. So really excited about you joining us. So I'm going to go ahead and share my screen. And Renee, at any time, if there's things that I'm missing, or really anyone that I miss or I don't hit everything, please let me know, and or just stop me and add to it. So let me see if I can get this into presentation mode. Just give me a second. All right. I don't see anybody's face. Maybe just let me know with the thumbs up or something if you guys can see this, or get off mute and let me know.
I can see it.
Okay, awesome. Thank you. So everything is working so far. And one last note is I apologize if I start coughing. I just came down with a cold, and I'm hoping I can get through this pretty well this morning. So we're going to go through we did our welcome and our introductions, and I wanted to spend a lot of time on that because I feel like that's so important that we get to know each other. And now we're going to kind of go through a little bit of history about the CCH, Community Care Hub. Jimmy will speak a little bit about our board of directors. We'll just run through quickly some of our projects that we're doing so you're aware of them, and then hit at the end some of the goals for 2025. All right, so Rochelle had mentioned to me yesterday that she had been talking to Renee and reminded me how many acronyms there are in this line of work. And if anybody has any experience, well, all of you have experience in healthcare and public health, and there's so many acronyms. So this might be a start of a list. Renee probably started her own. We'll combine it. We'll try to have maybe a resource somewhere where you can go to frequently to look up some of these acronyms. These are some of the acronyms that are going to pop up in this presentation. Also know that not all of them I've touched on, so I'll try my best to make sure I hit on those when I'm presenting on it here. And then this presentation I'll send it to all of you, so then you can go back and have this to refer to. All right, so Community Care Hub beginnings. Now, I know all of us are coming into the awareness of community care hubs differently, or some of you have been maybe part of some national organizations and hearing about community care hubs, and some of you this is completely new, and that's okay because this is a real new concept. Although it's been emerging for 15 years, it's just been in a whole bunch of different forms, and then just recently, for example, this slide in November of 2023, the US Department of Health and Human Services had issued a call to action for stakeholders to start to come and participate in community care hubs for an efficient, scalable approach for partnerships and a way to bring healthcare and social care together. And so there's a link here to learn more about that call to action. Again, that was just last year. And then a quote from this link and others that community care hubs can serve as the connective tissue within a community to ensure individuals' needs are met, social needs are met. So this is the actual official definition right now that's most recognized nationally. And a community care hub is a community-focused entity that organizes and supports a network of community-based organizations, in which we do, providing services to address health-related social needs. A community care hub centralizes administrative functions, operational infrastructure, and so forth. And what that does is we are actually taking on these functions and providing this infrastructure to our community-based organizations to build their capacity to sustain the very important work that they're doing in the community. So we are, sometimes you'll see, considered a backbone organization in the community. Again, building capacity. A bit about us. We officially became a nonprofit in 2020 as the Iowa Community Hub. You might see CHP Community in a lot of our maybe contracts and documents. So originally we started off as CHP Community Health Partners, and was it Renee, 2 years ago or so, we did a doing business as the Iowa Community Hub. And so now publicly, we're known as the Iowa Community Hub. We'll keep CHP Community on like formalized, legal documents and agreements, but really publicly, we're the Iowa Community Hub. Our biggest supporter and the organization that actually got us kickstarted is the National Association of Chronic Disease Directors. You'll see that NACDD acronym often in our presentation. And we actually became a partner of theirs in 2017. We contract with them for a number of different projects over the years, and they continue to be a huge supporter of us. We have been braiding funding ever since we started. This is exactly the model nationally, a lot of braiding and blending of funding. Although there's a goal to work towards an even more sustainable funding, which is healthcare contract payment, more to come on that. But we have a number of grants and contracts, and we'll share a little bit about those projects with you in just a moment. Our community care hub, if you know one community care hub, you know one community care hub. There are so different in that, not just regionally, different states. There's some that are AAAs, there's some that are local health departments, there's all sorts of different types of community care hubs. We happen to be a small group of part of a small group of community care hubs that this is all we do. This is our focus versus maybe we're a AAA, Area Agency on Aging, and do community care hub work. Nope, this is what we focus on. And there is also, though, part of community care hubs, we do have a commonality, though, throughout. It just looks a little different because we all want to make sure we're serving our community and our state specifically. Our mission, we support community partners to initiate, expand, and sustain health and wellness programs and services that address important health issues facing our communities. We worked on this mission with our Hub Advisory Group, which you'll see in just a moment. And the idea of our mission is to be, and we probably still need to work on it potentially and change it up a little bit maybe over the next years because things are changing a bit. And We want to make sure that everybody understands this mission. And so we want to make sure that we're not using jargon, we're using very understandable language, and that every culture can understand. So we'll do some translating, and there's lots of work and fun in that area, but this is our mission to date. What do we look like? Well, and I just actually thought of this, and I just because I just saw this pop up, and maybe I'll get to it at the end. I forgot our organizational chart internal, but this is our external chart. And we started back even before we were a nonprofit, started in 2019, the Hub Advisory Group. And we started this Hub Advisory Group because we were on a national collaborative with the NCOA, National Council on Aging, that was starting to do some training on becoming on community care hubs. And so we started this Hub Advisory Group back then. It was understandable, a kind of learning forum, bringing as many partners from across the state, from varied sectors, all together to start helping them understand this community care hub model. We have grown now to 85 plus individuals attending these meetings. We meet every other month. And again, it's a variety of sectors, from healthcare to government to academic to nonprofit. So many different type of organizations that have come together for doing this work. And what is this work? We're all trying to come together and better understand or create a clearer pathway to bridging healthcare and social life closer together. And so we have great conversations. Most of the time, too, we're talking about all the projects that we're doing, which involves a number of those partners. So that's in the middle. Obviously, we have our board of directors that has oversight over everything else. And then over the years, we've added these subcommittees where people want to take deeper dives in certain areas. So it goes from 85 to smaller numbers in these other groups. We have a community care hub subcommittee. This is a committee that we work on to elevate our navigators, our community health workers, and what we're doing in the community with community health workers. Membership, implementations, research. There's a lot here I can go into, but we don't have a lot of time. But I certainly would be more than welcome to, if you want to have a conversation specifically with me, and we could talk more about these groups. And if you have an interest and want to just sit in anytime on any of these groups, please let me know and I'll send you an invitation to learn more. This is a national model of what a community care hub looks like. And this one was done by the ACL, Administration for Community Living. And so most models of a community care hub has healthcare on the left side and community-based organizations, that's the CBO, on the right side. And then the community care hub is in the middle. We're the bridge. We bring both worlds together and help them communicate better, and help them work more collaboratively. And so on the left side, you'll see we work with payers. That's us as well. We have our payers at the table. We have our health systems working with us. We build referral pathways from our healthcare system partners into the hub. So I'll get to this more in just a moment. And then on the right-hand side, we have then the referrals that come in. We'll talk a little bit more briefly here about the navigation, and we get those people connected to the community-based organizations delivering, again, all this very important programming and social care services in the community. So here's another look at it. This one's a little bit faded. This is actually one that the National Association of Chronic Disease Directors created for us for Iowa, because this is how we work. This is our system. Again, left-hand side, left-hand side is our healthcare providers, systems, and then the right-hand side is our community-based organizations. We split that up into two different types. So basically, again, our clinic referrals come into the hub. And at our hub level, we have hub navigators. You've met them here today. They process those referrals, meaning they call on them, and you'll learn. I think in another slide, I actually mentioned this in a little more detail, but I'll share with you. They screen these individuals to learn more about their health-related social needs, and then they get them connected to social care services or resources in the community. So that's that top community-based organization for social needs. And then those community-based organizations provide us feedback, and there's a number of ways that that happens, provides us feedback whether someone is connected or not. And then, of course, our navigators help enroll people into the programs that they were referred into. So that's you saw on the other slide, that's the things like the diabetes prevention program, the Walk with Ease program, Tai Chi for arthritis. We support a lot of different programs. And all that program information comes back into the hub. And then between those two types of community-based organizations, we take all that information, crunch it at the hub level, and we send those reports back to the healthcare system. There's a better way to do that. We're doing it kind of clunky. Most CCHs are, because health systems aren't quite ready for the integration or interoperability we'd like to do with them, meaning we want to really connect our systems, our technology systems together. And I'll tell you more about a project that we're working on with one of our healthcare systems to do that even more efficiently. This is more of just a slide to share that Iowa Community Hub is again a community care hub. We help partners deliver programs. We also help people get connected to programs. Again, the hub navigators, they process referrals that come in, they screen them for health-related social needs, they enroll them in the appropriate evidence-based program through shared decision-making. So it's collaborative with the individual of what they get connected to, a collaborative decision-making process, and then connect them to resources that address their needs. We are featured, one of 4 different organizations or CCHs that were featured on this website. So if you want to check that out at some point, again, you'll have the link through this presentation that you can check us out. But we were, again, one of the top 4 that were highlighted in this on this website. Okay, looking at the time, go a little bit more quickly here. This is I just did this yesterday because I was thinking I want to show that we really live in 3 focus areas. So a lot of your work, sometimes some of you are working in one of these buckets or one of these areas primarily, and some of you um, I'm just going to share, like Michelle, because your face is right there, Michelle. I'm seeing you. Is that you work across different ones, different buckets. So, for example, on our website, you'll also see on that homepage that we connect people to programs. We build community organizations, that we build their capacity to deliver those programs, and then we work with healthcare systems and create easy ways for referral. Those are the 3 kind of focus areas. In navigation, we have obviously, you met them, very exceptional navigators, and we're hoping this year we can continue to build on that team. And we brought Ernesta in to be our lead navigator to help us build that team. That team is one very special area that we want to grow, especially with their training and experience in community health work. And so, again, I mentioned some of the things that happen in this navigation focus area. We also will talk in a moment about our community food program that they also work with, getting people connected to. Transportation and Housing Stability Fund, that's newer. That's our work with United Way 2-in-1 and trying to create a stability fund for people that we just can't find resources for them for transportation and housing. We will provide that funding. We are part of Inform USA, which is a kind of information referral network that gives policies and procedures and best practices and certifications on how to do that best and gather information and refer people to programs and services. We work with a number of partners. I just listed some of them there. I can go into more details in the future. Membership, this is a real area that Renee and I have been working a lot on, is one way that we believe we can build capacity and support our community-based organizations best is having them become a member of the hub, and then we surround them with lots of support. We will turn on an annual membership fee in the future, 2025, we're hoping. We've done a lot of work in focus groups within our hub advisory group to figure out what the best amount or fee would be for that. We don't want it to become a burden on our community-based organizations, but we do want to help take care of a bit of our administrative costs for providing all these benefits and support. So I'll get to the Umbrella Hub arrangement in just a moment, but there's a number of things that we do. We provide a program locator on our Hub website where they can find programs, where we post their programs so others can see them. We have instructor trainings tied to Iowa State to improve or get more and more of their staff trained. We also actually directly fund some organizations as best as we can. That's where we go out and get these grants. That's where Jen comes in, grant specialists, so that we can find funding for our CBOs. We provide them a place to collect data, report data, and then so on. Lastly, referral pathways. This is, again, working on providing our healthcare systems a number of different ways to refer to us, because one health system might have the capability to do a very highly sophisticated connection with our technology platforms. But then there's others that, you know what, hey, all we can do right now is a good old fax, and we're going to send you a fax to refer someone. And then we have other providers that are like, oh no, I'd love to go on your website, click on that button and refer through there. So we want to be sure that we are meeting our providers where they're at and where it fits in their clinical procedures, and providing them a lot of options. Eventually, we're going to work towards a gold standard, hopefully with everybody, of actually connecting our systems together. That's called interoperability, to interoperate with our Michelle's shaking her head yes, or nodding her head, I should say yes. Michelle has a lot of experience in this area with health information exchange. Another reason why we love what Michelle can bring to the table here to help us in that endeavor. We just haven't had a health system yet in our state ready to do that until now. And we do business associate agreements with our healthcare system. So share that we protect your health system or your patient information. And then lastly, healthcare payment contracts. That is our goal in 2025, to get to a healthcare payment contract and hopefully do more and more of these that will be more sustainable for us and for our community-based organizations. Okay, I'm going to
Nina,
go
real quick, I dropped in the
Yes.
chat, but which health system is it that's interested right now?
So Primary Healthcare is our pilot in the arthritis care model, and that's the pilot that we're working on to do this with them. So an FQHC in central Iowa, which then if we can do it well with that FQHC, there's 14 FQHCs in the state, and they will promote that to those other systems or to those other clinics. And then hopefully too, we have other health systems that are waiting to see how it works, and then we can start to bring them on too. All right, I just put my chat up now, so I'm trying to make sure I'm keeping an eye on that. Okay, I'm gonna go pretty quick here, you guys. Hang on tight. So Umbrella Hub organization, I spent just a minute on a slide here. It's complicated, so I wanted to at least spend a minute here on with it. This is what Michelle has come in to do. She's going to be our billing and Umbrella Hub manager. She's learning as much as she can, as quick as she can, about the UHO, the Umbrella Hub, or excuse me, UHA, Umbrella Hub arrangement, and for the hub, us, to become an Umbrella Hub organization. She's got lots of experience in billing, which will help, but this is pretty unique. So this Umbrella Hub arrangement here is a look at it nationally. So the Umbrella Hub organization, us in the middle, is supporting all these subsidiaries, which are community-based organizations. And what we're doing is we're going to provide them with a way to bill for the diabetes prevention program and get reimbursed by insurance. That right now and diabetes self-management education are the only two programs that are able to be billed and then reimbursed by insurance. But that's just a start. If we can do this really successful, we're going to try to get to our payers to do more coverage of more programs. So right now we're in preliminary recognition down at the bottom, soon to be full recognition, and you got to go through these stages. We are not ourselves a deliverer of these programs. We are called a non-delivery UHO because what we do instead is we support those programs in the state. We support them doing this work. We got to get to full recognition. We're almost there. Then we can apply to be a Medicare supplier, which means then we can bill Medicare. So that's where we're heading. I'm going to stop there and give Jimmy a moment to share just a bit about the board of directors.
Thank you so much, Trina, and good to see everyone. And I'll be very quick here. I'm really excited because one of the things that we have been working on is to work with the consultant, Kim Stewart. She has been great on helping us to look at the bylaws. That has been one of our major milestones and things that we wanted to get off the ground just to make sure that we're in alignment with the mission and the vision of the hub. Also, I'm very thankful of Sheila and Trina because of their expertise, guidance, and also the historical context on revising that particular bylaws. So I don't want to go into a lot of detail, but some of the things that we worked on the document itself is the organizational history. We looked at the purpose of the hub, the mission, the vision, the board of directors, including the composition of the board, the officers and the duties, and also the different committees, including the executive committee, the board development committee, and that the board development committee is so essential, and that's who we are, looking at the bylaws and revising that language and massaging things that need to be modified and making sure that we're in alignment with what we are doing currently. Also, we are after we've met several times. We worked for about 3 weeks or so, several meetings that we had, and then Trina sent that off to legal counsel, which again, it's very good to have them review the language, make sure that we are in compliance with the law, and making sure that they can provide additional edits to that document. So again, we'll go into more detail the next time, but that's one of the major work. One of the major works that we have been working on in the past couple of weeks. The other area that is also that I've been involved right now is being with the AHRQ, which is the Agency of Healthcare and Quality Research and Quality grant with the University of Iowa, Iowa State. Trina, I'm finalizing my edits, so I'll send them to you later today. I'm just looking at you. And that's a grant that it's expedited. They needed immediate assistance. I think it's going to be submitted here in the next couple of weeks. So been working on that as well. But I am just really thankful that we also have additional board members that are interested. I think at the last organizational meeting, we had a couple of people interested. We had about 3 reach out to us. I am meeting with them next month just to engage them, to let them know that we're still working on the onboarding process, the vetting of new board members. But it's exciting that people just reached out to us willingly to be part of the hub. I mean, we're getting a lot of momentum. People are excited of the work, very appreciative of the monthly meetings that we have with Trina and all the different stakeholders in Iowa. So we're becoming well known. It's a great opportunity to be engaged. And again, thank you, Sheila and Trina, for all the work that you've been doing with the bylaw, especially. And that's all that I have for now.
Thank you, Jimmy. Awesome. Perfect. All right. And we're really excited for to have Jimmy lead our board of directors. He's really fabulous. All right. Let's see if I can get this going here. So some of the hub projects, this is what's going to go fast. We have a number of projects currently running. We do a lot with our partners in these grant projects. Again, what we're trying to, these are grant projects and contracts. Remember, what we're trying to do is bring funding into the state that obviously will help support some of our capacity building, but mostly also sending that out to our community-based organizations to either support their programs or also to cover some of the social care needs that maybe aren't being met across the state. So CDC Arthritis Grant, that's being led by ISU. That's a statewide grant. And it's 5 years long, and it's to get 6,500 people through an arthritis appropriate evidence-based intervention. It's a mouthful, so people call it AABI, AAEBI. And there's 23 of them. And so there's a lot of work going on trying to get people connected to AABIs. The Arthritis Care Model pilot, get to that in a second. That's through our National Association of Chronic Disease Directors and the CDC. We were picked of any other organization nationally to test this model. We have a CDC grant with ISU for falls prevention, Walk with Ease. We're partnered with the University of Iowa. They have the lead of an ACL falls prevention grant, lots of fall stuff. We are the lead on a U.S. Aging Center of Excellence Community Care Hub grant that helps us build capacity. We are contracted with Iowa HHS on their CDC diabetes grant. And we have a community food project, which you'll see in a moment, that we're lead on, and we have had some really great funding there to cover monthly food boxes delivered to the homes of participants. And then a DASH, Data Across Sectors of Health Incubator grant that helps us capture lived experience. That's where Ben and Keisha's work falls into. So CDC Arthritis Grant, like I said, 6,500 individuals to enroll in an Abbey by the end of 2028. This picture here is just to show you that we have a lot of partners involved in that, a lot of different teams, referral sources, that's like healthcare. We have connector partners, like those that are connecting people to services now, like United Way 211, Find Help, Unite Us, if you've heard of those things. We're all coming together to try to do that better together. We have then on the other side, everything to do with delivering different ABBYs, again, arthritis appropriate evidence-based interventions across the state. We're initially starting with Tai Chi, Walk with Ease, and the CDSMP, which is the Better Choices, Better Health program in Iowa. This is a little bit of our achievements. I'm going to leave it for you guys to look at on your own when I send this presentation, but we've had a really great first year. This is the arthritis care care model,
I'm
also
sorry,
known
Trina. I don't think
as.
you're sharing your screen. I apologize.
Oh, I'm not.
I thought I could
Maybe it's
do
my
it.
Not seeing
computer.
any of that.
Oh, no, I could see that.
Oh, you can see it? Okay.
Yeah.
Sorry, Trina. I
Okay.
don't know why my computer's not showing. Okay, never mind. Sorry, Trina.
You can maybe, no, that's okay. Maybe try to pop in and out.
I will do that. Thank you.
Okay. All right, so the arthritis care model, also known a mouthful as a public health framework for collaborative arthritis management and well-being. Easier to say the arthritis care model, but look how it shows on the left side again, healthcare, and our partner being the primary healthcare primary healthcare. There you go, Jimmy. On the left-hand side, and us, the community care hub, on the right-hand side. So when patients come in on the left-hand side into the blue, the providers are screening them. They're going to screen them for physical activity. They're going to screen them for pain. They're going to screen them for falls. And then if they have also a diagnosis with osteoarthritis, then they give them some brief advice, tell them a little bit about these wonderful programs that are happening in the community, refer them then over to the green. That's again where our navigators come in, again, screening for social determinants of health through shared decision making, get them connected to the programs and the resources in the community. And then all of that information from our community-based organizations come back into our hub, and then we share that back on the left-hand side. This is our community food project. We felt like a lot of our participants, one of their chief complaints was not having food. We wanted to do our part. So for anyone that screens or shares that they have a need for food when they're talking with our navigators, we also connect them then while they're participating in a program, monthly home delivery of these fresh produce boxes. They're about 10 to 12 pounds that get delivered to their home as long as they're participating in a program. So that's one way for us to take care of that. We're now past that number. We're going to show you, we just started this in February. We're going to show you another number in a moment. Jen, do you have a minute and really a minute to go through this one?
Yeah, so this goes along with the Produce Box project. We received funding from Iowa HHS to implement a project in partnership with Grace Fitness in Des Moines. And so for that, we're really looking at policy, system, and environmental level changes to address healthy eating and active living among individuals who are eligible for SNAP. So participants at Grace Fitness will receive these produce boxes delivered monthly while they're participating in their program. We'll be doing a community asset mapping with a coalition that we're just kind of starting up to identify what specific physical activity interventions to implement within this community. And this is where we'll be working with Ben and Keisha on capturing some lived experience from participants at Grace Fitness. And we're also able to pay those participants for their time and sharing their lived experience and their participation on the coalition. So more to come on this project.
That was perfect. Thank you. Lastly, here's some numbers. So far, we've had 3,411 participants go through some programming that's connected to a partner in our state, 515 individual healthcare referral sources, and we're at least probably a month ago up to 265, or probably closer, Renee, to maybe 300 by now of participants receiving food. So I'm going to escape here and stop sharing because we're at the end. One chart that I did not share is our organizational chart. And what we'll do is make sure that we send that. Yours looks much better than what I've had, Renee, so we'll maybe get that sent out. I was also going to have maybe Savannah do something creative for us, but it'll show our organizational chart. I'll make sure you guys see that, and then we'll also be meeting with each of you to go through it, maybe with more explanation to it. I know we didn't have much time, and I know we threw lots at you in this meeting, but hopefully that gave you, again, just a quick look at what we're doing, where we've come from, and who's who, and met the people in our organization. And hopefully that at least gets us some motivation and hope for 2025. I'm going to also share the 2025 goals. It's in this presentation as well. And I've also mentioned them along the way when I was presenting some of those goals, but I'll share all this with you that you guys can review. Any questions from anybody? I know we're just a little bit over.
I just want to thank the team for all of the work that you guys are doing. I know that I haven't met you in person. I'm hoping that eventually I'll get to meet you in person. So again, we're in Des Moines and in Iowa. So I think it'll be nice. I think, Trina, you've mentioned meeting in person at least once a year. So looking forward to how we can make that happen. But I just want to wish everyone a happy holiday and thank you so much for all of the work. I think you have my email, but I'll put that also in the chat and also my number in case if you need to contact me for anything. I'm happy to here to support you. So thank you.
Excellent. Thank you so much, Timmy. All right. Anybody else?
This was wonderful.
All
Thank
right.
you.
Good, 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 good. All right, everybody. Well, happy holidays to you. Take care. Hopefully get some rest. And again, looking forward to 2025. There's a lot of great things on the horizon here that we're about to do. So thank you for this amazing team that has come together.